Mira, Dave, good evening. These doctors come to work every day testing patients for COVID, treating them for almost everything. So when it comes to the COVID-19 vaccine, why are some of them forced to wait?
I just want to make sure that the people in my position aren't forgotten.
Dr. Paul Thomas is a primary care physician in Detroit and Farmington Hills. Even through the pandemic, he comes into work every day, and his office treats more than 900 patients.
It's really important for us to be here in the office.
This month, Dr. Thomas watched as other frontline doctors began receiving the COVID vaccine. Right now, the state is at phase 1A, vaccinating persons who have direct or indirect exposure to patients or infectious materials. While Dr. Thomas says he falls into that category, he's not received the vaccine, nor been told when he will. And he says it's partly because of where he works.
If I were to be employed by a large health system, we probably wouldn't be having this conversation.
Well, doctors who are affiliated with the Beaumonts and Henry Fords of the world were some of the first to be vaccinated. Independent physicians with no hospital affiliation say they've been forgotten.
I kind of know how others view me, that I'm sort of the low man on the totem pole.
Dr. Phil Hellman is an independent physician in Rochester Hills. Well, he didn't see many COVID patients during the start of the pandemic.
Now I have a lot and deal with it on a daily basis, whether it's testing or trying to get treatment for people that have it.
But he's received no vaccine and doesn't know when he will. We asked the State Department of Health and Human Services when doctors like these will be vaccinated. In a statement, they said, "It is important that staff at our independent clinics receive the vaccine, particularly those that are in priority group 1A. We are working closely with our local health departments and health systems so that they are able to work with these clinics to have their staff receive the vaccine. The exact date they will be received depends on the location and the vaccine allocation at the local level."
It's just frustrating to watch colleagues of mine getting vaccinated and not having that same opportunity just for the fact that I'm independent.
Now, the doctors and nurses and assistants who work in these independent clinics understand that they may not be able to receive the vaccine tomorrow or the day after tomorrow or even next week. But they say if the state would at least communicate with them, let them know when they can expect something, that would be better than nothing. We're live in Detroit tonight. I'm Ross Jones, 7 Action News.